Okay, so tell us who you are and what we're here to talk about today.
Sure. My name is Luciana Catanese, and I'm a stroke neurologist here at Hamilton General Hospital, and also the medical stroke lead for the stroke unit and hyperacute stroke in the region, in the Central South region of Ontario. And today we're going to be talking about EVT, which stands for endovascular treatment. It's a highly specialized, life-saving treatment that we can offer for patients with severe strokes.
So can you explain to us, what is EVT clot removal? How does it work?
It's a minimally invasive procedure that is done sort of in a micro OR called angiosuite. And it's carried by a neurointerventionalist who threads in a small wire through the femoral artery that is located in the patient's groin and navigates it with the assistance of X-ray imaging all the way up to the brain until reaching the area where there is a blockage. Once we are in that area where there is a blockage, then we can use either a suctioning machine or a stent to actually mechanically remove the clot. And that's why sometimes it's also known as clot retrieval procedure.
So what are the main advantages of this type of treatment?
So the main advantage is that it does increase the likelihood of a patient regaining back their functions.
That's so exciting, and it's wonderful to see improved patient outcomes. What would the outcomes have been prior to a procedure like this?
That's a great question. Before we have endovascular therapy, so before 2015, actually we were only able to offer the clot busting medication. The issue with that is it's not as effective for these major occlusions. Actually, the likelihood of opening one of these occlusions with just that medication is about 10 to 20%. Versus 80 to 90% with actually the mechanical retrieval.
That's a huge change. Wow, that's wonderful. Is there something unique about the work that we do here at HHS that's really supporting some of these innovations?
Yes, actually, we're very lucky here at HHS. We are a really tight multidisciplinary group that is highly specialized. So because of our volumes are so high, our neurointerventionalists actually have a lot of experience doing these procedures. And this is important because that decreases the chances of having a complication from the procedure and increases the chances of benefiting from them. And we also are, leaders in innovation. We have adopted this software called CT perfusion that allows us to take pictures of the brain and in real time see what's the area of the brain that has suffered irreversible damage and the area of the brain that is still alive. And in that way, we can actually select patients throughout the spectrum of time, all the way up to 24 hours for these treatments. So we are quite unique and advanced, I would say, here at HHS.
It's so exciting to hear you talk about your work. I mean, what's really inspiring you? What's the most rewarding part of this work for you?
Oh, that's easy. It's the patients. Once you are a front-line worker and you see firsthand the impact that a stroke has on an individual and their families, it becomes pretty clear pretty quickly that is one of the most important things you could be doing. It's deeply meaningful for me, and I know for everybody else in our team. We wake up at 3 in the morning, right? We don't think twice. We know someone's life is at risk. And it's the most precious thing, right? A human life. So that is the main driver of everything we do here.
That's wonderful. Thank you so much for sharing your work with us today.
My pleasure. Thank you.